Millions of people around the world rely on supplements to support their health, and in many cases, they're necessary. However, taking some of the most popular supplements, like magnesium, vitamin D3 and K2, or even vitamin C, the wrong way, can sometimes do more harm than good. In today's video, we're uncovering 9 serious mistakes, some of which can be potentially fatal, that many people make when using these common supplements. These aren't just minor oversights. Each mistake can significantly jeopardize your kidneys or heart. And the final mistake we discuss is perhaps the most dangerous of all. Before we dive in, please hit that like button and subscribe to the channel to help more people who will benefit from the video discover it. Let's get started. 1. Not adjusting for age-related renal changes. One common mistake when taking supplements is not adjusting for age-related changes in kidney function. As we age, our kidneys naturally become less efficient at filtering and regulating electrolytes and waste products. This means that what might be a safe dose for a younger person can be problematic for someone in their 70s or 80s. For instance, while a younger adult might efficiently process 420 to 500 milligrams of magnesium glycinate or a serving of electrolyte powder that contains 1,000 milligrams of potassium, older adults may struggle to handle these amounts due to reduced kidney function. When the kidneys can't adequately filter out excess potassium, it can accumulate in the blood, a condition known as hyperkalemia. Hyperkalemia is one of the most dangerous imbalances because it can lead to irregular heartbeats, muscle weakness, or even life-threatening cardiac arrest. Because of these risks, it's especially important for older adults to consider their unique health needs and consult with a healthcare professional before starting any high-dose supplement regimen. This is particularly crucial if their diet is already balanced, as adding extra supplements might lead to unintended complications rather than providing additional benefits. 2. Combining NSAIDs with supplements. Millions of people rely on NSAIDs on a regular basis for pain management and inflammation relief. But combining these medications with certain supplements can be very dangerous due to potential drug-supplement interactions that amplify adverse effects. Some supplements, such as fish oil, vitamin E, ginkgo biloba, and garlic, are known for their blood-thinning properties. When these supplements are taken alongside NSAIDs, which can irritate the gastrointestinal lining and impair platelet function, the risk of internal bleeding increases significantly. This combination can lead to severe complications, including gastrointestinal bleeding and the development of ulcers, because NSAIDs weaken the stomach's protective barrier while the blood-thinning effects of these supplements further compromise its integrity. In addition to gastrointestinal risks, both NSAIDs and some of these supplements may place additional strain on the kidneys, potentially leading to kidney damage, especially in individuals who are already susceptible to renal issues. Given these potential dangers, it is crucial for anyone considering the concurrent use of NSAIDs and blood-thinning supplements to seek medical advice. A healthcare professional can help assess individual risks and provide guidance on safe supplementation practices, ensuring that the benefits of these supplements do not come at the cost of serious health complications. 3. Not taking the correct ratio of vitamin D3 and K2. Vitamin D3 and K2 are among the most consumed supplements around the world right now because they work synergistically to support bone health and cardiovascular function. Vitamin D3 enhances calcium absorption from our diet, but without a proper amount of vitamin K2, the extra calcium may not be directed to the bones as intended. Instead, it can accumulate in soft tissues such as the arteries and kidneys. Studies have shown that an imbalance, where vitamin D3 is taken without sufficient vitamin K2, can increase the risk of soft tissue calcification. This is particularly concerning for kidney health, as excess calcium can lead to the development of kidney stones and impaired renal function. Research suggests that an optimal ratio is around 1,000 IU of vitamin D3 to about 100 micrograms of vitamin K2 daily, a balance that helps ensure calcium is efficiently channeled to the bones rather than depositing in the kidneys or arterial walls. Furthermore, it is crucial to take the correct form of vitamin K2. The -7 Malawian Kwacha's form is generally recommended due to its superior bioavailability and longer half-life compared to -4 Malawian Kwacha's. This form provides more consistent support in directing calcium where it's needed, thereby protecting the kidneys and cardiovascular system. 4. Thinking it's okay to have a bad diet as long as you take supplements. Many people mistakenly believe that taking supplements can make up for a poor diet, but this is a dangerous misconception. Supplements are designed to complement a healthy diet, not replace the essential nutrients found in whole, unprocessed foods. When you consume a diet high in refined carbohydrates, sugar, and processed foods, your body's ability to absorb and utilize nutrients is compromised. For instance, even if you take magnesium supplements, a diet filled with refined sugars can interfere with magnesium absorption, rendering the supplement less effective. Similarly, the benefits of vitamin D3 and K2, zinc, omega-3 fatty acids, and other supplements can be significantly reduced when your overall diet is lacking in balanced, nutrient-rich foods. A poor diet not only limits the bioavailability of these supplements, but can also contribute to chronic inflammation, insulin resistance, and other metabolic issues that further impair your health. Essentially, supplements are meant to enhance an already healthy diet, providing additional support where needed. Relying on supplements as a substitute for nutritious food is likely to worsen your health in the long term. To achieve optimal wellness, it's crucial to focus on a well-rounded diet that naturally provides the foundation for nutrient absorption and overall bodily function, with supplements serving only as an added boost where necessary. 5. Introducing too many supplements at once. Introducing too many supplements at once is a serious mistake that can cloud your understanding of what is truly helping or harming your body. For instance, if you're experiencing heart palpitations or muscle cramps and suspect that you might be deficient in magnesium or potassium, adding both supplements simultaneously might seem like a quick fix. However, if your symptoms improve, you won't know which supplement was responsible for the improvement, making it difficult to accurately address the underlying deficiency. Science supports a cautious approach. Research indicates that targeted supplementation, introducing one supplement at a time, allows for proper assessment of its effects on your body. For example, clinical studies on magnesium supplementation have demonstrated that gradual dosing and monitoring can effectively reduce muscle cramps and improve cardiovascular function without overwhelming your system. Similarly, potassium supplementation must be carefully managed, as excessive intake, particularly when combined with other supplements, can lead to dangerous conditions like hyperkalemia. To give more examples, taking multiple supplements together can obscure potential adverse reactions. If you experience side effects such as digestive issues or irregular heartbeats, it becomes challenging to pinpoint which supplement is the cause when they are all introduced simultaneously. Another layer of complexity is added by nutrient-nutrient interactions. For instance, certain vitamins and minerals can interfere with each other's absorption when taken together, potentially diminishing their benefits. 6. Megadosing on vitamin C. Megadosing on vitamin C, particularly in its synthetic form, ascorbic acid, is a serious mistake that many people make. Many individuals treat vitamin C supplements like harmless mints, popping them indiscriminately throughout the day without considering how much they're actually consuming. While vitamin C is essential for immune support and antioxidant protection, excessive intake can lead to unintended health problems. One of the major concerns with megadosing is the increased risk of kidney stones. When you take more vitamin C than your body can utilize, it is metabolized into oxalate, which can bind with calcium to form kidney stones. Several studies, including research published in the Journal of the American Society of Nephrology and JAMA Internal Medicine, have linked high doses of vitamin C to an elevated risk of kidney stone formation, particularly in men. These findings underscore that more is not always better when it comes to vitamin C supplementation. In addition to kidney stones, taking vitamin C in excessively high amounts can cause gastrointestinal issues such as diarrhea, nausea, and abdominal cramps. The body naturally excretes excess water-soluble vitamins like vitamin C, and when this excretion is pushed to extremes, it can overwhelm your digestive system. Moreover, high doses of synthetic ascorbic acid may lead to an imbalance in your nutrient absorption, potentially interfering with the effectiveness of other vitamins and minerals in your diet. 7. Taking supplements on an empty stomach to maximize absorption. Taking supplements on an empty stomach in an effort to maximize absorption is a common mistake that can backfire, particularly when it comes to fat-soluble vitamins like vitamin D3. While many people assume that an empty stomach will speed up nutrient uptake, the reality is that vitamin D3 and other fat-soluble vitamins, actually requires dietary fat for proper absorption. Without fat in your meal, your body's ability to absorb these nutrients is significantly reduced, meaning you may not get the full benefit of the supplement. Additionally, taking supplements on an empty stomach can lead to gastrointestinal discomfort, such as nausea or cramps, which further detracts from their intended benefits. Another important point to remember is that many minerals depend on vitamin D3 for optimal absorption and function. For example, magnesium is essential for heart rhythm and muscle function, but its effectiveness can be compromised if your vitamin D3 levels are low due to improper supplementation. Imagine someone trying to address heart rhythm issues with magnesium supplements, only to find that the magnesium isn't working as expected because their body isn't absorbing it properly. This could be a direct result of not taking vitamin D3 with a meal that includes healthy fats, which in turn affects the absorption and utilization of magnesium. Research has shown that vitamin D plays a critical role in the regulation of various minerals, and without adequate levels, the benefits of magnesium and other nutrients may be diminished. 8. Ignoring interactions between supplements and diuretics. Ignoring interactions between supplements and diuretics can lead to severe, even fatal, consequences due to the delicate balance of electrolytes that both affect. Diuretics work by increasing urine output, which not only removes excess fluid but also causes the loss of essential minerals like potassium, magnesium, and sodium. When supplements, especially those containing potassium or magnesium, are taken without proper monitoring alongside diuretics, they can dangerously tip the electrolyte balance. For example, potassium supplements should be used with extreme caution in patients taking potassium-sparing diuretics such as spironolactone or amiloride. Combining these can lead to hyperkalemia, a condition where potassium levels become so high that they may trigger life-threatening cardiac arrhythmias. Similarly, even with diuretics that deplete potassium, adding potassium or magnesium supplements without careful dosing and regular blood tests can result in unpredictable shifts in electrolyte levels, putting strain on the heart and kidneys. Scientific research has consistently highlighted these risks. Studies published in reputable journals like the Journal of the American College of Cardiology and the American Journal of Kidney Diseases have documented cases where improper management of these interactions has led to critical heart rhythm disturbances and other severe complications. These studies underscore the importance of medical supervision when combining diuretics with any supplements that influence electrolyte balance. 9. Not adjusting doses in response to side effects. Not adjusting your supplement dosage in response to side effects is a common and dangerous mistake. For example, magnesium glycinate is widely regarded as gentle on the stomach and is often chosen to avoid common magnesium-related gastrointestinal issues. However, if you begin to experience diarrhea or other stomach-related problems while taking magnesium glycinate, this could be a clear signal that the dose is too high for your body. Ignoring these signs and continuing with the same dose not only prevents you from addressing the underlying issue, but also increases your risk of overdosing on magnesium. Overdosing on magnesium can lead to serious health problems, including electrolyte imbalances, heart rhythm disturbances, and in severe cases, magnesium toxicity, which can affect muscle and nerve function. While it's true that some individuals can safely handle therapeutic doses of 500 milligrams or more without any adverse effects, this tolerance is highly individual. Just because one person can manage a high dose does not mean you can too, especially if your body is already sending you warning signals like digestive discomfort. Listening to your body and adjusting your dosage accordingly is crucial for ensuring that the supplements you take are benefiting your health rather than putting it at risk. Thank you for watching. Remember, before adding any supplement to your routine or making significant changes to your diet, always consult your healthcare provider. Your health is too important to leave to chance. If you found this video helpful, please like, share, and subscribe for more informative content. Stay informed and take care.